Before watching this video, don't forget to click on the subscribe button. Cofcol Elixir syrup belongs to the category fever and pain. Composition: each 15 ml Cofcol contains paracetamol, pseudoephedrine HCl, chlorpheniramine maleate, dextromethorphan HBr, and vitamin C. You may check the picture for the proper amount. Indications or uses: Cofcol elixir relieves the following symptoms associated with cold, influenza, allergies, and other upper respiratory disorders: nasal and sinus congestion, runny nose, sneezing, watery eyes, general discomfort, coughing, fever, minor sore throat pain, headache, body ache, and pain. Dextromethorphan is a cough suppressant that affects the certain part of the brain as cough center that reducing the urge to cough. Decongestant help relieves stuffy nose symptoms. Antihistamines relieves watery eyes, itchy eyes, nose, throat, runny nose, and sneezing. In short, Cofcol elixir syrup is used for the fast, effective temporary relief of the symptoms of cold, cough, and flu. Dosage: for the tablets, adults 1 tablet 3-4 times daily, and for the Cofcol elixir syrup for adults 2 tablespoons full every 4 to 6 hours, maximum 8 tablespoons for around 24 hours, and for the children 6 to 12-year old 1.5 teaspoon 4 to 6 hours. Not to use: it is contraindicated in patients with known hypersensitivity to the drug. Side effects of Cofcol elixir syrup. So the side effects are including drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth, nose, throat may occur. If any of these effects last or get worse, so tell your doctor or pharmacist properly. Drugs to avoid while taking Cofcol elixir syrup. So the drugs that may interact with this medicine include warfarin and cholestyramine. Precautions: if you are taking the over-the-counter product, read all directions on the product package before taking this medication. If you have any questions, so consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Use with caution in severe hypertension or coronary artery disease patient. If you are using the liquid form, use a medication measuring device to carefully measure the prescribed dose. Do not use a household spoon if your liquid form is a suspension. Check the bottle well before each dose. If your condition persists or worse, or if you think you may have a serious medical problem, seek immediate medical attention.